Okay, hi. I'm Dr. Jaspal. I'm a resident obstetrician gynecologist here in Park City Medical Center. I'm also the head of unit of ONG here. Today, I'd like to just talk to you a little bit about a very important issue that women today face. It's about menopause. The reason why this is such a pertinent issue is because these days, with increasing longevity, women are reaching much older ages, and so it becomes important that they know how to take care of themselves to prevent complications that may happen in view of their older age. Menopause generally happens because the ovarian follicles loses its function, and so the hormone estrogen is reduced, and that will lead to certain symptoms that a woman generally tends to face much earlier than the menopausal age. In Malaysia, the menopausal age is roughly around 49 to 50, and 4 or 5 years before that, they tend to have symptoms like hot flushes, night sweats, sometimes mood disturbances, difficulty in sleeping, bone pains, difficulty in passing urine, dryness of the skin, loss of hair. These are many symptoms that are actually seen from as early as 45 years of age, and in a very few women they may even be seen much earlier, from around 40 years of age, and this would be a premature menopause. We need to evaluate each woman thoroughly before we can actually institute any form of treatment. We have to go through a very detailed history to know about her lifestyle changes, to know about her diet, exercise programs, if her family has a history of cancer of the breast, or any other genital cancers. All these are pertinent to starting therapy for menopause. Other important investigations would be a blood investigation to look at her liver function, bone mineral density to look at her to see if she's in osteoporosis. Mammogram would be important to make sure that she's not having any changes in the breast that may lead to cancer later on. And other investigations which may also be important will be all done together before instituting therapy. It's been the dictum to start therapy with minimal dose and to use it for a very short period of time, and the usual age of starting it would be early rather than late. However, recently a lot of studies have shown that it's not necessarily just to treat menopausal women for a short period of time, especially if they are well monitored, they do not show side effects to the drug, and they are not at high risk for other complications. The therapy can actually be continued under supervision for a much longer period of time. Of course, generally a lower dosage is started so that side effects can be monitored, and with lower dosage there would be less side effects. The side effects that women have when taking hormone replacement therapy are minimal. They may have body changes, they may have fluid retention, which may cause an overall feeling of increasing weight, but generally not really so. They may have breast engorgement in the beginning, but most of these symptoms tend to subside just like when they are taking an oral contraceptive, and these symptoms would probably not be realized, or even an active woman would not have many of these symptoms that generally tend to happen with a more sedentary person. The best time to start medications, of course, when they are turning menopause, and rather than to start it much later in life, because much later in life they would have already undergone certain changes which may increase the risk of complications with hormone replacement therapy. There are many routes of administration of the drug. It can be oral, it can be through gel and creams, implants, injections. So each person would have to be tailored to a particular route of administration. As long as there are no major side effects and complications, women may be able to use hormone replacement therapy for 10 to 20 years. Some of the important complications that have been brought about, that have been highlighted, especially in some of the recent studies, include stroke, thromboembolism, and cardiovascular disorders. This may result because of certain types of hormone replacement therapy, which are generally synthetic and may tend to cause effects that are not seen when you use a more natural type of hormone replacement therapy. Of course, it's also important to look at a woman as a whole. It's a holistic management. Obese, smoking lady with a history of hyperlipidemia or cholesterol in the family may generally tend to have more chances of these side complications occurring compared to a more healthy women. So at the end of the day, lifestyle changes are very important. It's important to encourage exercise, an active lifestyle, to watch your food, to balance diet, and also to monitor your blood for some of these tests that will tell us if you're heading towards any particular complication while using your hormone replacement therapy. Some of the lifestyle changes that I think should be encouraged is to make sure that the woman is active, start some form of exercise program, even if it's yoga, avoid beverages like caffeine, alcohol, or keep it to a minimal. Smoking is definitely a no, and of course there are certain tests that we would do regularly when you are on the hormone replacement therapy, so that we are well aware that if you are heading towards any particular complication. There are other forms of alternative management for menopause as well. It's not every woman is suitable to have a hormone replacement therapy. There are alternatives that are herbal in, like for example, black cohosh, red clover. These are certain herbal therapies that may be used, and of course, like you've heard of soya bean, which may contain phytoestrogens that may seem to be beneficial in trying to reduce the symptoms that women have from menopause, but it may not generally provide the protection for the heart and for the bones that is generally available through hormone replacement therapy, especially if it started early. Having said that, hormone replacement therapy is not necessarily a therapy for osteoporosis or cardiovascular diseases in menopause women, because there are many other different therapies available. But in general, starting early, your chances of prolonging these issues or delaying these issues would be higher.